Hello everyone. The topic of lecture is removable orthodontic appliances. The functional removable appliance is defined as one that change the posture of the mandible, holding it open, closed, forward and backward of the mandible. Passive tooth bone are activator, bionator, Herber's twin block. Active tooth bone, modification of activator and bionator. Tissue bone appliances are the Frankel appliances. The removable orthodontic appliances are devices that can be inserted into and removed from the oral cavity by the patient self. Advantage of the removable appliances: patient can continue oral hygiene procedure without any hindrance. Tipping movement of teeth can be carried out. Appliances more cons- appliances are more conspicuous as generally more acceptable to patient. Relatively simple appliances can be delivered and modified by general dentist. Appliance fabrication is done in specialized lab, hence chair side time is considerably less than the fixed appliances. Since few movements are carried out simultaneously with these appliances at a time required to activate an appliance is less. The appliance required simple inventory to be maintained as compared to complex fixed appliances. Appliances are relatively cheap. Disadvantages of removable appliances: patient cooperation, capable of any certain type of movement. Multiple movement are difficult if not possible. Patient has to have certain amount of dexterity and skill to remove and relapse the appliances. Chances of appliance breakage and loss. General principle of removable appliances: appliances work by tipping of tooth around the center of resistance, which is located between 30 to 40% of the root apex. The forces exerted are depending on kind of appliances, type of movement, type of contact, type of tissue surrounded by tooth or spring and plastic. A component of removable appliances, they are the retentive component, active component, and the base plate. Retentive components are help in keeping the appliances in a place and resist displacement of the appliances. Success depends on the large extent on a good retention of the appliances. They are loosely fitted and do not bring about necessary tooth movement. Adequate retention of the removable appliance is achieved by incorporating certain wire component in undercuts are called the clasp. Mode of action: act by engaging certain area of a tooth called undercuts. The wire is meant to engage these undercuts to prevent displacement of the clasp. Type of undercut: buccal and lingual, cervical undercut, mesial and distal, proximal undercuts. Buccal and lingual undercuts. Buccal and lingual surface of a molar have distinct undercuts. Undercuts available in fully erupted permanent teeth. Ideal requirement of clasp: offer adequate retention, permit use in both fully and partially erupted teeth, offer adequate retention even in presence of shallow undercuts. Pipe thin seal should not apply any forces. Be easy to fabricate, not impinging the soft tissue, not interfere with the normal occlusion. Various different type of the class: circumferential, also known as the C class, Texan class, Adams, South and triangular. Various type of the class. When we're talking about the circumferential class, it is also known as a three-quarter class or a C class. Simple class designed to engage buccocervical undercuts. Wire is engaged from one proximal undercuts along the cervical margin, then carried over occlusal embrasure as a single retentive arm on a lingual aspect embedded in an acrylic base plate. Advantages: Simplicity of design and fabrication. Disadvantages: cannot be used in partially erupted teeth, cannot be used in a carious teeth, cannot be used in the decayed teeth. Jacobson uterus, introduced by Jackson in 1906, also called as U-shape. Class engage buccocervical undercuts and also mesial and distal undercuts. Wire is adapted along buccocervical margin in both occlusal abrasion to end retentive arm on both the side of the permanent molar. Advantages: simple to construct and adequate retention. Disadvantage: inadequate retention in primary eruptive teeth. Adams clasp, first discovered by Professor Philip Adams, also known as the Liverpool clasp. These clasps provide maximum retention when constructed properly. Made up of 0.7 mm hard stainless steel wire. Adams clasp is made up of 2 arrowhead, 1 bridge, 2 retentive arms. Advantages of Adams clasp provide following advantages. It is rigid and offer excellent retention. Can be fabricated on both deciduous and permanent dentition. Used on partially and fully erupted teeth. Used on molar, premolar, and incisor. No specialized instrument is needed to fabrication of these clasps. It is small and occupied minimum space. Can be modified a number of ways. Following are ways of modification of Adams clasp. Adams clasp with single arrowhead. Adams clasp with J hook. Adams clasp with incorporated helix. Adams with additional arrowhead. Adams with shoulder buccal tube. Adams with distal extension. Adams with incisor and premolar. This is the Adams with single arrowhead. This is also Adams with single arrowhead. This type of clasp indicate in a partially erupted tip, which is used in last erupted molar. Single arrowhead is made to engage the mesioproximal undercuts of last erupted molar, mostly second molar. Bridge is modified to encircle the tooth distally and end on the palatal aspect of the retentive arm. This is the Adams clasp modification with J hook. The J hook is incorporated in the Adams clasp bridge. This is also Adams with J. J hook can be soldered on a bridge of the Adams clasp. Useful in engaging elastic. Basically जो ये J hook है हम इसको इसलिए शोल्डर करते हैं ताकि जो हमें इंटरनल इलास्टिक पेशेंट में डिलीवर करना है तो आप इस इलास्टिक को J के साथ एंगेज कर सकते हो. This is the Adams with incorporated helix. इसमें ब्रिज के साथ हेलिक्स को एंगेज किया हुआ. This is also Adams with helix. Helix is incorporated in the bridge of Adams clasp. This helps in engaging the elastic. ये भी हम elastic के लिए ही use करते हैं. Adams with additional arrowhead. This is also Adams with additional arrowhead. Arrowhead को Adams के बीच के साथ shoulder किया हुआ. Adams can be constructed with an additional arrowhead engaging proximal undercuts of the adjacent tooth and its shoulder on the bridge of the Adams. This type of class give additional retention. Adams with shoulder buckle tube. ब्रिज के साथ buckle tube को हमने shoulder किया हुआ. This is also Adams with shoulder buckle tube. Buckle tube is a shoulder on the bridge of the Adams class. This modification permit use of extraoral anchorage using phase bow, headgear and the phase bow headgear हम यूज करते हैं पेशेंट में हम एक्स्ट्रा फोर्सेस देने के लिए, तब हम इसको इंगेज कर देते हैं एडेंस में ताकि हम बीच के साथ एंकरेज हमें प्रोवाइड हो सके. This one is the Adams with distal extension. This is also Adams with distal extension. Class can be modified so that the distal arrowhead has a small extension incorporated distally. Distal extension help in engaging elastic. This is the modification, another Adams on the incisor and premolar. This one is for the Adams on incisor. This is also Adams on incisor. Adams class can be fabricated on the incisor and premolar when retention is required. It can be constructed or a single tooth or the tooth and an incisor, or it can be used in an incisor and a premolar. Southern class used when retention is required in anterior region. Wire is adapted along the cervical margin of the central incisor. Distal ends are carried out over occlusal embrasure to end as a retentive arms on the palatal side. Triangular class. This one is the triangular class. They are small triangular shaped class that are used between two adjacent posterior teeth. They engage the proximal undercuts of the two adjacent teeth. Indicate when the additional retention is needed. Ball end class used in twin block appliances. Fabrication using stainless steel wire having a knob or a ball like a structure on one end. Ball can be made at the end of the wire using a silver shoulder. Perform wire having a ball end, one end and are also available. Ball engage proximal undercut similarly to triangular class. Indicate when additional retention is required. This is the another modification which is not used in patient. Various disadvantage because of the design is not good, pinch in the soft tissue, oral hygiene is not maintained. This class is usually not used. These are the various disadvantages. Need spatial arrowhead forming pillar fabricate, occupied a large amount of space in the buccal vestibule. Arrowhead can be injured in the interdental and the soft tissue. Difficult and time consuming of fabrication. Resemble a full class but has an additional piece of wire shoulder with engaging into the mesial and distal proximal undercuts. Offer better retention than a full class. Now we are talking about the active component. The active component: bow, spring, screw, elastic. Bow. Active component that are mostly used for incisor. Short labial bow, long labial bow, split labial bow, reverse labial bow, Roberts retractor, Mills retractor, high labial bow with apron spring, fitted labial bow. This is the short labial bow. Construction using 0.7 mm hard round stainless steel wire. This is the consist of a bow that make contact with most prominent labial tip and two U-loops that end the retentive arm distal to the canine. This type of labial bow is very stiff and exhibits low flexibility. Activated by compressing the U-loop, indicate in case of minor overjet reduction and anterior space closure used for the purpose of the retention at the termination of the fixed orthodontic therapy. Long labial bow. It is similar to the short labial bow, except the extension from the premolar to the opposite premolar. Distal arm of U-loop are adapted over occlusal embrasure between the two premolar to get embedded in the acrylic plate. Activation similar to the short labial bow, modified from a long labial bow and can be made by a shortened distal arm to the bridge. Indication: minor anterior spacing closure, minor overjet reduction, closure of space of distal to the canine, guidance of the canine during canine retraction as a retentive device at the end of the fixed orthodontic treatment. Split labial bow used for the, it is basically used for the midline closure. These are the split labial bow. Reverse labial move, also called as a reverse move, and the move is a reverse, and it is used in the extraction space. Robert's retractor is the labial move made up of gauge stainless steel wire 3 mm, 0.5 mm diameter along the incorporation of the coil make the labial bow highly flexible. As the bow is a highly flexible at leg, adequate stabilities in vertical plane. Mills retractor, high labial bow with apron spring. These are not used in a patient because of the design and fabrication and unwanted tooth movement. Fitted labial. These are the spring classification based on the presence of helix, simple compound based on the pressure of loop or a helix, helical and looped based on the nature of stability, self-supported and supported spring. Ideal requirement of spring: simple to fabricated, easy fit, easy clean, apply force of required magnitude and direction, should fit into available space without discomfort to the patient, should not spread on the dislodge when the patient over the sloping to surface, should be strong, should be remaining active for the longer duration, for the longer period of the time. Factor are these are the dimension of the wire which we have to we all हम सबको पता होना चाहिए. Flexibility depending upon the force generated by length of the wire, patient comfort. These are the finger spring. Z spring, double cantilever spring, also known as a double cantilever spring. T spring, not used in a patient because of severity of disadvantage. These are the not the coughing spring. Canine retractor. This is the U-loop canine retractor. Helical canine retractor. Buccal shell supported canine retractor. Palatal canine retractor. Screw. Elastics. Base plate. All the component of the appliance into one unit, help to anchor the appliance in the plate, help in distributing the force over a larger area. Bite pin can be incorporated into the plate to treat the specific orthodontic problems. Thickness should be 1.5 to 2 mm. Material used can be cold cure or heat cure. प्रॉब्लम क्या क्या रहेगी रिमूवेबल अप्लायंसेस के साथ? ओरल हाइजीन मेंटेनेंस, सॉफ्ट टिश्यू इरिटेशन, caries, pain, tooth mobility, breakage of the appliances. These are the references. Thank you.